Hello, my name is Asiya Ashraf. Student ID S333871. Course title Certificate of Higher Education in Health and Social Care. My PowerPoint slide shows about assertive communication. I've analyzed the strength and limitation of using assertive communication style in health and social care. First, I'll go through introduction. So, a communication style which helps people to express their ideas, needs, and feelings confidently and respectfully is known as assertive communication. My presentation will comprehensively discuss the assertive communication style, considering its strengths and weaknesses. This will also show the application of assertive communication in health and social care. This will represent a situation in which the communication style is effective or challenging. Lastly, this will make recommendation for improvement. First of all, we need to understand what is assertive communication. Assertive communication helps people to express their concerns calmly, directly, and respectfully. The professional use this communication style. They maintain eye contact, professional tone, and better body language. Such communicators honestly express their opinions, but they do not intimidate or overlook others. They use active listening for understanding patient concerns so that they can respond effectively. This helps develop better relationship with their clients to get better results of what they are doing. Strength of assertive communication. As strength in itself, assertive communication supports the professionals to build their interpersonal trust and respect. This helps decreasing confusion, mistakes, and misunderstanding in different sensitive settings. This enriches teamwork because this helps the team members to share data, feedback, discuss concerns properly and others. This also supports the professionals to listen to the concerns of the clients properly and attentively. This helps them to explain their services, products, and how these can meet the current needs of the clients. This also helps informing and clarifying different relevant concepts. When the professionals communicate assertively, they become more confident, organized, and professional. This helps developing the confidence, trust, and loyalty of the clients towards the organization or service providers. I gave you a list of benefits of using assertive communication styles. But on the other hand, there are also limitations. So, limitation of assertive communication are as follows. Some people consider the assertive behavior as overly direct or rude in sensitive situations. People try to understand what others are saying based on their cultural background. So there are some cultures which promote indirect communication. Such people can misinterpret culture differences. In emotional and stressful situations like emergencies, conflicts, and others, people might find assertive communication difficult. For using the assertive communication style, the communicator needs confidence, emotional control, practice, and others, which might be missing in some communicator. Staff and managers at some workplaces lack passive communication patterns in order to resist open communication. In health and social care settings, the professional widely use assertive communication for discussing treatment plans, to instruct and discuss the health issues of patients. In multidisciplinary teams, the professionals use assertive communication for clearly sharing important data. This assertive communication style also helps the professional to manage conflicts in expressing concerns, maintaining respect to all the people involved. This terminates the possibility of accusation. Again, in safeguarding situations, professionals use assertive communication for reporting their concerns and protecting the vulnerable people. This supports the healthcare professionals to communicate medication, risks, and care positions of patients to enrich the safety of patients. I will now discuss situations where assertive communication is effective. In patient consultations, the professional use assertive communication for clearly discussing the medical data and listening the patient concerns. Again, in shift handovers or team meetings, the professional use assertive communication for sharing data accurately and decreasing the risk for errors. In emergency situations, healthcare professionals need to discuss clearly and confidently for stabilizing patient safety. When the professional gives constructive feedback to their colleagues and students, they use assertive communication for inspiring improvement and terminating the possibility of unnecessary conflict. When the professionals are managing complaints, they need to stay calm, solution-oriented, respectful, and follow the professional standards. I'll now discuss challenges and suggestions for improvement. In challenging situations, some healthcare professionals become low confident for assertive communication. Due to stress, the professional make rush communication, which causes misunderstandings or emotional reactions. The care providing organization needs to train staff on communication to build their confidence, professionalism, interpersonal skills, and others. The healthcare organization should inspire the professionals for empathy, active listening, and showing respect to diverse patients. They need to arrange training on cultural awareness so that the staff can modify their communication styles based on the cultural background and social background whom they are communicating to. Lastly, conclusion. So, my conclusion for this assertive communication style is: in health and social care, assertive communication is important. It supports teamwork, developing professional relationships. This helps the patients in foster safety to the patients and give quality care. This inspires honesty and confidence for terminating the possibility of misunderstandings. Nevertheless, the challenges are cultural differences, emotional situation management, low confidence, and others. The professional should focus on training, empathy, and reflective practice for enriching their assertive communication skills.